PPE. My scene is safe. The mechanism of injury is that my patient fell on the stairs. There's one patient. No reason to call for additional resources at this time. And I'm going to hold manual C-spine. My general impression is that my patient is lying supine at the bottom of the stairs with no movement. I'm going to have my partner hold manual C-spine. I'm going to check for responsiveness. Ma'am, can you hear me? No response. For level of consciousness, just not alert to verbal stimuli. Painful, no response. My patient is unresponsive at this time. I'm going to open airway, insert an OPA. If my patient does not accept, I will insert an NPA instead. Breathing, my patient is not breathing at this time. We will use a BVM and administer high flow oxygen. Circulation, we're going to check pulse. The pulse is rapid and weak. The skin feels pink. It's pink, warm, and dry. I'm going to check for any obvious bleeding. Nothing there. I'm going to initiate shock management. We'll keep the patient supine, keep oxygen flowing, and keep the patient as warm as possible. According to the GCS, which is 3 at this time, there's no eye movement, no motor function, and no verbal at this time. It is a high priority patient, and we will transport as soon as possible. I'm going to obtain vitals and attempt to get a sample history and begin my head to toe assessment. I'm going to be looking for decap BTLS in the head. Nothing there. Look in face, ears, eyes, nose. I looked in the mouth when I entered the OPA. There's nothing there as well. Jaw. Look in the neck. Feel the neck. Look for tracheal deviation, JVD, and check C-spine. We're going to put a C-collar on and check shoulders, clavicle, the chest, sternum, down ribs, abdomen. Nothing there. I'm going to listen to lung sounds and for the heart. Going down to the hips. From there, I'm going to make sure there's no obvious injury to the genitals. Check down the legs. Check the motor function. No, there is a pulse. Ask the patient if they can feel me. A response there. I'm going to ask them to push, to pull, wiggle their toes. No response. I'm going to feel this leg. Check for pulse. There is a pulse. I'm going to ask them if they can feel me. They can push, they can pull, they wiggle their toes. No response there. I'm going to check their legs, their arms. Check pulse. There is a pulse. And ask them to wiggle their fingers. Ask if they can hear me. If they can feel me. If they can squeeze my hand. No response there. Check this one. Check the pulse. There is a pulse. Ask them if they can feel me. They can wiggle their fingers. They can squeeze me. No response there. I'm going to turn them on their side to check their back. It's on the head's count. check all down the side, all down the back of the spine, and on the buttocks, and back down on the head's count. When we transport, I will be reassessing every 5 minutes and managing any secondary injuries. At this time, there was none.